One form of violence is believed to enhance beauty and purity. Instead, it scars forever. An estimated 180,000 girls living in Europe are at risk every year.
Female genital mutilation comes in different forms, from pricking of the clitoris to stretching of the labia, to partial or total removal of the genitalia.
One of the most severe types of FGM is infibulation. The outer lips and the clitoris are removed, sometimes with a razor, causing a lot of blood loss. A small twig might be inserted before the wound heals, to create a small hole so the woman can use the toilet and continue to have periods. Some girls will struggle and may be pinned down so hard that their bones fracture. Afterwards, the legs are bound together for up to 4 weeks to allow the wound to heal, making intercourse and childbirth impossible, so a husband will know that he's marrying a virgin.
Circumcision has existed from the time of the Prophet of God and has been organized by the Prophet himself.
The Quran does not say anything about female genital mutilation. It is a tradition that has unfortunately existed in this country for centuries.
Although there's no endorsement in the Quran, some hardline clerics strongly support the practice.
The cultural practice of FGM, please.
Yeah, FGM is like it's traditional practice. In Samburu, you cannot be married if you have not gone through that female genital mutilation, that cutting. And they also said you are not a grown-up if you are not cut. And if you get pregnant also, when you are a girl, you have not, before you are cut, they kill that child because the child is not holy in the community, so it have to be killed. And I went also through FGM, and I know very well how it is.
The short-term effects of FGM, if you imagine these procedures are done in general not by medical personnel, they're done under unsterile and unsanitary conditions. They're done without any anaesthetic or analgesia on a small child. The immediate consequences are obviously damage to the genital organs, removal of the genital organs, damage to surrounding organs. And this can lead to hemorrhage and to infection. The other effects which are more difficult to measure are, it's clear that there are great psychological effects if you think about the trauma of such a procedure, so long-lasting psychological damage to women that have undergone this. And also increasingly we realise that it would cause psychosexual problems. So if you have your clitoris removed, so you have no sensation and the vagina is narrow and sex is painful, then psychosexual problems are also extremely common. Because the instruments are not sterile, you also have an increased risk of blood-borne infections such as hepatitis B and HIV. Girls and women are left with urinary problems such as incontinence, unable to control their urine, or recurrent urinary tract infections. It increases the risk of infertility. If, however, you do manage to become pregnant, you have an increased risk of hemorrhage during childbirth. There's also an increased risk that the baby may die during labour or shortly after birth.
When I realised how horrific it is, I knew I had to campaign against it.
I'm that girl who's undergone FGM, and my mission has always been to save at least one girl. One girl means break the cycle and save a generation.
It's time to confront the taboo. It's time to act. It's time to end female genital mutilation.